The statement read, "The assessment team is of the opinion that Dr. Lubitz is currently unfit to practice medicine." The statement was devastating. To say it was a blow to her ego, her identity, her sense of purpose would be an understatement. What would people say? What would they think? Shame filled her being. She had no history of malpractice, no DUI, no patient complaints. Nothing in her record hinted at unprofessionalism or incompetence. And yet, after voluntarily submitting to a 5-day professional evaluation from the Massachusetts Medical Society's Physicians Health Services, an organization designed to support physicians in distress, the conclusion was clear. She wasn't fit to practice. And the most painful part, they were right. To return to medicine, she would have to step away from it. Rehabilitation, a monitoring program, a reckoning not just with her profession, but with herself. What seemed like an unraveling of her life was, in truth, the long overdue acknowledgement of its state. She was in crisis, a crisis that had been years in the making. She had endured the relentless demands of the pandemic, the heartbreak of a miscarriage that left her staring into the abyss of suicidal thoughts, the devastating loss of a colleague and dear friend to suicide, the slow erosion of a 25-year marriage that ended in divorce. Dr. Carrie Cunningham, her married name, the former world-ranked tennis star turned brilliant oncologist and endocrine surgeon, an NIH-funded researcher investigating thyroid cancer, a fixture in national surgical organizations, and past president of the Association of Academic Surgery, was known for her groundbreaking work. Her tireless dedication, her unrelenting pursuit of excellence. Talk about clout and reputation. 80-hour weeks, skipped meals, sleepless nights, the culture of medicine applauded her endurance. And so she pushed through exhaustion, ignored depression and anxiety, and silenced pain. She sought help sporadically when time allowed, but in a system where performance was paramount, therapy, appointments, and, self-care were the first casualties of an overbooked schedule. At first, it was the anesthesia of busyness and alcohol. It took the edge off the stress, the anxiety, the gnawing depression, but over time, it deepened the darkness. The signs of emotional collapse were undeniable: insomnia, anxiety, emotional numbness, shame. But admitting them, confronting them, that felt like a greater risk than pushing through. She feared that acknowledging her suffering and would jeopardize everything: her reputation, her career, the image of resilience that she had spent a lifetime cultivating. On the outside, it looked like success. On the inside, it was chaos. Still, she kept going. That is until one evening in the spring of 2022 when the wheels came off completely. Over drinks, she admitted that she had been suppressing something for years, that she was struggling, that she was not okay, that she was thinking about suicide. Her caring colleagues took her seriously. They called her boss, they voiced her concerns, and just like that, the carefully constructed facade of resilience crumbled. She was not happy about that. She was angry. It went against everything she had trained to be. Now, as a practicing physician in recovery, keynote speaker and activist for physician self-care, she would be the first to tell you, in a field that daily tends to suffering and pain of patients, the cost of emotional neglect is steep. The debt compounds over time, and when the bill comes due, it is devastating. But she would also tell you this: The investment in emotional self-care is priceless. It is life-giving, and it is necessary to move forward. So, what is the cost of emotional neglect? Can it go unpaid? The reality check is delivered by Dr. Rimmon when she says, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. Well, that's kind of stinging, isn't it? Have you ever played the game of neglect? Anyone? Anyone raise your hand? You played the game of neglect? It's kind of fun. I personally like it. You probably don't know what I'm talking about, so let me show you. Yeah, this one, Jenga, or kujenga, which is Swahili, a Swahili word which means to build. You see, Jenga was created by Leslie Scott, no relation, as far as I know. But a Tanzanian-born British game designer, author, and businesswoman, and the co-founder of the Oxford Games. And she created the game, which was born out of her childhood. They used to play with blocks in the early 1970s, and she made a game out of it. Now, there's something interesting that this game prizes, right? Dexterity, coordination, precise to precision, and strategy. And I suppose if you throw in some science and stoicism, you might have a medical profession. Yeah? Physicians are often praised for their ability to endure suffering without acknowledging their own needs. Not just physicians, pretty much most healthcare clinicians. The culture of medicine celebrates stoicism and self-sacrifice as a badge of honor. Oh, yeah, that's what makes Jenga fun, right? We all play till that end, and then we start again. Well, what happens in real life? Well, we celebrate self-sacrifice as a badge of honor. Look how dedicated they are. Translation, they skip meals, worked 80 hours in the week, pushed through exhaustion. They never complain. Translation, they suppress distress, compartmentalize emotions, and normalize suffering. They always put patients first. Translation, they consistently put themselves last, and personal life relationships suffer. Yeah, what kind of suffering are we talking about? Substance use problems, bad behavior at work, affairs, family problems. The cost of emotional neglect is steep. I mean, are there benefits to compartmentalizing? Yes. When you're running a code on a patient, you need to think through a differential diagnosis, or after a potential surgical case, and you're running to the next one and the next one. You want your team to be present and rise to the occasion. The health of the patient depends on it, but it mustn't always come at the expense of the clinician, must it? Did you notice what happened in that clip? Everyone, they ran to the person. Oh, I'm so sorry. Let that happen in real life. Is that what happens? Oh, you were carrying so much. Oh, I understand you were working 80-hour plus hours. Or is it met with something else? Judgment? Shame? How come you couldn't keep it together? Why are you falling apart? How come you didn't do more with this budget? We would like to think, and we would hope to think, that people would run to our rescue. But sometimes in the culture of medicine, when the things fall apart, shame quickly follows. Now, most of us have, well, if you were to imagine your career like a game of Jenga, and each block represents something essential. I mean, everything all solid and put together. I mean, it gets me thinking about Dr. Salman Fuller. Some of you might know of him. He was a medical a psychiatrist and also a neurologist. He earned his medical degree from Boston University in 1897 and discovered two brain abnormalities that are the hallmark indicators of Alzheimer's disease and neurofibrillary tangles and amyloid plaques. He understood that necessarily you didn't have to have those always to be able to die from Alzheimer's. And Dr. Alois Alzheimer's actually picked him. Now, the interesting thing about him, he was also an African-American. So, by the way, this is like your lecture and African-American history lesson today, although you were going to get it anyway, whether it was February or not. So, I mean, I was giving you the same information if it was May 5th. But I think something that's important about him is that he ran to the university when he applied. He said, "I want you to accept me as a medical student." That's pretty gutsy. And you know what? They took him. Talk about having something all together. When you remember in your training, when you first started out, eager, ready to go, starting out in medicine, you thought, this is what it's going to be for me. And so your tower was solid. But as training progressed, pieces are removed one by one, rearranged. Maybe after a while you discover that emotional expression gone. In other words, detach. Don't get too close to your patients. The balance that you had between work and private life, gone. Real doctors sacrifice everything. What about sleep and nutrition? How are you doing in that department? And self-care? Gone. I mean, except for the snacks that you grab on the way. And the final piece, the belief that you deserve care too. Where's that? Did that get rearranged? Where does that block fit in your Jenga tower? Despite the missing pieces, towers don't collapse immediately. Why? Because medicine rewards the ability to stay upright no matter how unstable the foundation becomes. But here's the truth. Every Jenga tower falls. And when it does, it doesn't just take down the clinician. It impacts patients, institutions, families, and the entire future of medicine. So you understand the physiology of neglect. Many of you do, I'm sure, because when we think about it, we think about the hypothalamic pituitary adrenal axis, leading to prolonged cortisol elevation. And over time, this impairs the immune system, increases inflammation, and erodes cognitive function. Well, what's the problem with this? Well, what happens, it changes. It's a physiological change in the brain's prefrontal cortex and amygdala. Why is that important? Well, these are the regions critical for executive function and emotional regulation. Health clinicians are proud and take pride in their decision making. It's necessary. It's crucial. It's timely. It's life-giving. Neglected emotions often manifest in maladaptive coping mechanisms, detachment, cynicism, and even substance use. The weakness it's not weakness, it's physiology. Our emotional health is not separate from our ability to practice medicine. It's foundational to it. But just like Jenga, the structure weakens over time. Even the most resilient clinicians can only remove so many pieces before the entire tower collapses. The consequences of this emotional neglect are profound. And so as we have heard, and Dr. Wade talked about this in a way that is moral injury, where you feel that you have gone and given of yourself and maybe gone against your values. It doesn't feel good. It sits with you in a difficult way. Suppressing this pain leads to guilt anger, and detachment. One of these key ones that we have experienced in this area is witnessing patient suffering without the ability to help, at least to the degree that we were able. And this was at the height of the pandemic. Situations that we saw that where during COVID-19, ICU healthcare clinicians had to decide who would get ventilators and who wouldn't due to equipment shortages. Some patients were left to die that could have survived under normal circumstances. Maybe not necessarily on this campus, but in definitely surrounding areas. If you are coming into that and then going home from that, that's heavy. You didn't come into medicine for that to be your experience. It would feel like a moral injury. Maybe feeling overworked to the point of medical errors. I can tell you this as a therapist that works on this campus. I have had conversations with professionals around this very issue. Burnout and depression. This is difficult because when it comes down to this, the research shows around 60% or so would rather conceal their depression and risk dying from it than to be caught going to get help for depression. Understand, putting their life at risk for suicide, to die, so that they won't be shamed. In other words, death or death. I have to say, it takes a lot, maybe, to be able to show up sometimes to a therapist's office, but it shouldn't. The stigma is heavy. And suicidality is high, especially in women. It's higher in women than men, but men are also high, especially within the medical profession. And it's more than the general population, unfortunately. Sometimes in a year, you can lose as many as you would have in a medical class. Over 625 people. Imagine that. Real people. Silence, fearing stigma. What about relationship breakdown? Many of us, all of us here, have some sort of meaningful relationship, marriages, friendships, also parenting. There's increased loneliness. If we don't take care of ourselves, this is the cost. Addictions, substance use, outbursts, workplace toxicity. That's not who you were on your mission statement when you first started this profession. You've probably seen it maybe in your residents, maybe some of the people in your learners, in your trainees. Cognitive impairment, chronic stress, sleep deprivation, emotional suppression. This all leads to toxicity in our lives. It's not okay. We can be better. We do not need to put our patients at risk. And the cost is like over $4.6 billion when it comes down to due to around emotional neglect. $4.6 billion? That's a lot. Imagine what that money could be used for. Let's talk about ethics. Well, actually, before we get to ethics, I'm going to go to this actually because I want to stop here. Licensing boards and stigma. I know this is a real thing that when I talk to residents around this issue, it's like, well, if I need help, what will happen to me? Will I be reported? The fact is that is a troubling thing. It's like I need to choose between a career and then getting healthy. And some choose, well, I'll just white knuckle it and hopefully nothing happens to me. Is that how we want to send our people into the world, onto the floor, into the operating room, into the patient physician relationship, healthcare clinician relationship? Otherwise, people suffer in silence. Workplace culture. Teams are necessary. Teams build trust. We need trust to be able to be effective in our healthcare, but with burnout and distress, and people are afraid because the shame will be internalized. I will be seen as weak and unable. I can't risk that. Medical leave backlash. that when Dr. Garner was talking about this, about shame, something that you should be shamed for, or something that people put on you, something that comes that is inside. People will say that I can't get help. I don't want to be perceived in a bad way, so I will stay and push through. And then if you do go away, then it's like, oh, you had a nice vacation. And then when you need to just take care of yourself. So, ethics of neglect. The framework emphasizes duty and moral obligation, and when you talk about deontological ethics. And so physicians have a duty to provide the highest standard of care. Neglecting their own emotional health violates this duty. And just as we are obligated to care for our patients, we are ethically bound to care for ourselves. Consequentialism, the perspective, says that emotional neglect leads to negative outcomes. Higher rates of medical errors, decreased empathy, increased physician turnover. When physicians suffer, the patient care also suffers. Addressing emotional health is not just a personal concern, it's a systemic necessity. What about virtue ethics? The approach emphasizes character and moral integrity. So a virtuous healthcare clinician is compassionate, not just toward patients, but also towards themselves. By fostering resilience and self-care, clinicians embody the virtues that make medicine a noble profession. When we neglect our emotional health, we compromise the ability to provide ethical and patient-centered care. Beyond individual ethics, there is a systemic responsibility. Healthcare institutions must foster cultures that support rather than penalize emotional well-being. So what do we do about it? Well, breaking the cycle is important. So here are 4 key strategies: emotional awareness and reflection. So regularly checking in with yourself. What am I feeling right now? What do I need? Journaling. Speaking with a trusted colleague can help the process and can help reduce emotional burdens. Number 2, boundary and recovery practices. Practicing our well-being means setting limits, implementing micro recoveries during shifts, deep breathings, brief walks, even macro recoveries outside of work, such as exercise, creative pursuits, meaningful relationships. Speaking of creative pursuits, if you stop at the A-level gallery, you'll see physicians and their art, or their pictures about what they're doing when they're not doctoring. And we had asked for any time, there's no shameless plug here, for you to submit to Physician Vitality your photos of what you do when you're not doctoring, so that we can see that life is more robust. Community support. Connection is proven a buffer against burnout. Peer support groups, mentorship, simply having a trusted colleague to debrief and with can mitigate emotional exhaustion. The burden is lighter when it is shared. Reframing help seeking as strength. Seeking therapy or coaching can be seen as professional development, not failure. High-performing athletes have coaches. Why shouldn't high-performing physicians or healthcare clinicians have mental health support? So, where's he? If it's there, okay. I have an exercise for you. I want you to turn to a neighbor. I know some of you guys are spread out, but I have this one, and make it quick. I only have maybe a minute to 30 seconds for this. But I want you to ask this one question of yourself, and then share the answer with someone next to you. What moment in the last month reminded you of why you do this work? So go ahead, share it with the person next to you. What moment in this last month reminded you why you do this work? Once again, make it quick. All right? By you being able to share this, what you are doing is actually being able to buffer against burnout. It provides a deeper way of connecting and building support. It's building community. You are right now sharing the load. That's what this is about. So, how to rebuild the Jenga Tower? Practical strategies for healthcare clinicians? What I would like you to think about is, instead of playing the game of neglect, physicians and healthcare clinicians must start reinserting blocks into their tower, one at a time. Redefine resilience. True resilience isn't about enduring suffering, but recognizing when to rest, process, and heal. Emotional debriefing. Regularly processing emotions with a trusted peer, therapist, or coach that can prevent internalized distress. Set boundaries without guilt. Protecting time for family, rest, personal growth isn't selfish. It's essential for longevity in medicine. Normalize seeking support. Every physician should have a confidential, judgment-free space to navigate stress and moral dilemma. And I have to say, at least on this campus, you can find that with Physician Vitality. Advocate for systemic change. Institutions must eliminate punitive mental health reporting policies and implement guilt-free wellness leave. It's important. There's nothing that causes people to freeze up more, probably professionally, outside of an error, than thinking that they're going to be shamed for getting help. The cost of emotional neglect is not just personal, it's professional. It's ethical and it's systemic. We can no longer afford to push through until we break. Instead, we must cultivate resilience, not through denial, but through intentional emotional care. Imagine a field of medicine where self-compassion is as routine as hand hygiene. Remember that during the pandemic? Where colleagues, and it is ingrained in your colleagues, that is as normal as patient advocacy. The Hippocratic Oath calls us to do no harm. But how can we fulfill this oath if we are harming ourselves through neglect? If we fail to create and sustain systems of support that support physicians and that support physician well-being, are we not complicit in a culture that perpetuates harm? Medicine is a calling that demands excellence, but excellence is not possible without sustainability. Taking care of ourselves is not an indulgence, it's an ethical imperative. So can we say we are ethically fulfilling our oath to give our patients our best and do no harm if we neglect the instrument administering the care? An elder was asked by a certain soldier if God would forgive a sinner. According to Thomas Burton, this comes from his book, The Wisdom of the Desert. The elder said to him, "Tell me, beloved, if your cloak is torn, will you throw it away?" The soldier replied and said, "No, I will mend it and put it back on." The elder said to him, "If you take care of your cloak, will God not be merciful to his own image?" Since God is merciful, should we not be merciful to ourselves and each other, especially in our time of need? It is our duty.